Heart attacks, medically known as myocardial infarctions, are a serious medical emergency that affects millions worldwide. A heart attack, or myocardial infarction, occurs when blood flow to a part of the heart muscle is suddenly blocked. This blockage prevents oxygen rich blood from reaching the heart muscle, causing damage to the heart tissue. Heart disease is the leading cause of death worldwide, claiming nearly 18 million lives annually. In the United States alone, someone has a heart attack every 40 seconds. Surprisingly, 1 in 5 heart attacks occurs without the person even knowing it. When a heart attack strikes, time becomes the most critical factor. The saying in cardiology is time is muscle, meaning every minute counts. Recognizing the warning signs of a heart attack is crucial. The most common symptom is chest pain or discomfort, often described as pressure or squeezing. Other symptoms include pain in the arms, back, or jaw, shortness of breath, cold sweat, nausea, and lightheadedness. Women may experience less typical symptoms. If you suspect you or someone else is having a heart attack, call emergency services immediately. Don't wait. Every minute counts. Remember, heart attacks are serious medical emergencies, but with prompt treatment, many people recover and lead full lives. Understanding heart attacks can help save lives. Atherosclerosis is the gradual buildup of plaque in the walls of arteries. In a healthy coronary artery, blood flows freely through the vessel, delivering oxygen to the heart muscle. Over time, atherosclerosis develops as substances like cholesterol, fats, calcium, and other materials accumulate in the artery walls. As these plaques grow, they narrow the artery and restrict blood flow to the heart muscle. Several factors increase the risk of developing atherosclerosis, including high cholesterol, smoking, high blood pressure, diabetes, obesity, and a sedentary lifestyle. As atherosclerosis progresses, these plaques can become unstable, setting the stage for more serious complications. When a heart attack occurs and blood flow is blocked, heart muscle cells begin to suffer from oxygen deprivation. In normal conditions, heart cells receive plenty of oxygen, allowing for efficient aerobic metabolism. When oxygen supply is cut off during a heart attack, cells are forced to switch to anaerobic metabolism. Anaerobic metabolism produces significantly less energy, only about 2 ATP molecules compared to the 36 to 38 ATP produced during aerobic metabolism. Anaerobic metabolism leads to the buildup of waste products like hydrogen ions and lactate, which can be toxic to the cell. As waste products accumulate, they disrupt the cell's ionic balance, causing water to flow into the cell. This results in cell swelling. Heart muscle cells can only survive about 20 minutes without oxygen before permanent damage begins. With each passing minute, cellular damage accumulates. Waste products build up, cell membranes become unstable, and mitochondria begin to fail. After approximately 20 minutes, the damage becomes irreversible, leading to cell death and permanent heart muscle damage. In summary, when heart cells lose their oxygen supply, they quickly experience metabolic changes that lead to energy depletion, waste buildup, and swelling. This progressive damage becomes irreversible after approximately 20 minutes, highlighting why rapid treatment is essential during a heart attack. Section 7. Spreading damage and cell death. When blood flow to part of the heart muscle is blocked, oxygen can't reach the heart tissue. During a heart attack, a blood clot suddenly blocks an artery, stopping blood flow to part of the heart muscle. Within minutes, cells directly downstream from the blockage begin to suffer from oxygen deprivation. After about 20 minutes, cells in the center of the oxygen-deprived area begin to die, a process called necrosis. As time passes, the damage spreads outward from the center. The central zone of dead cells, the necrotic core, expands. Surrounding the necrotic core is an area of at-risk tissue. These cells are injured but still viable. They can be saved if blood flow is restored quickly. After 4 to 6 hours without treatment, most of the affected heart muscle dies and becomes scar tissue. This damage is permanent and irreversible. This is why the phrase time is muscle is so important in heart attack treatment. The longer treatment is delayed, the more heart muscle dies permanently. Section 8. Warning signs and symptoms of a heart attack. Recognizing the warning signs of a heart attack is crucial for getting timely treatment. The most common symptom is chest pain or pressure that may feel like squeezing, fullness, or a heavy weight on your chest. This pain can radiate to the left arm, jaw, or back. Beyond chest pain, there are several other important symptoms to be aware of. These include shortness of breath, cold sweat, nausea or vomiting, and unusual fatigue. It's important to know that heart attack symptoms can vary widely, especially in certain populations. Women often experience different symptoms than men. They may feel extreme fatigue, shortness of breath, nausea, and back or jaw pain, sometimes without any chest discomfort. Elderly individuals might present with confusion, shortness of breath, or fainting as their only symptoms. People with diabetes may have minimal or no pain due to nerve damage from long-term high blood sugar. If you or someone else experiences any of these symptoms that might indicate a heart attack, immediate action is critical. Call emergency services immediately. Don't wait, drive yourself, or have someone drive you to the hospital. Remember, time is muscle. The faster you get treatment, the better your chances of recovery. The goal is to restore blood flow within 90 minutes of arriving at the hospital. Emergency treatment for heart attacks focuses on restoring blood flow to the heart as quickly as possible. The first-line treatments include aspirin to prevent clot formation, nitroglycerin to dilate blood vessels, and oxygen to increase oxygen supply to the heart. Thrombolytic drugs, also known as clot busters, work by breaking down the fibrin protein structure that holds blood clots together. These medications flow through the bloodstream, reach the clot, and gradually dissolve it, reopening the blocked artery. For many patients, the preferred treatment is a procedure called primary percutaneous coronary intervention, or PCI, where a cardiac catheter is used to place a stent. During this procedure, a thin catheter is inserted through a blood vessel, typically in the groin or wrist, and guided to the blockage in the heart. A small balloon at the catheter tip expands along with a wire mesh stent, reopening the blocked artery and restoring blood flow. In heart attack treatment, every minute counts. Medical professionals emphasize that time is muscle. The longer treatment is delayed, the more heart muscle dies permanently. The first hour, often called the golden hour, is critical. Treatment within 60 minutes saves the most heart muscle and significantly improves survival rates. Emergency treatment protocols are designed to minimize delays and provide the fastest possible intervention, as each 30-minute delay increases mortality risk.